Hi, this meeting is for Project Unify, and it is May 11th. And we'll be focusing on the consent to share utility. It's a working group meeting to advance the work. Sometimes people, okay. Well, whoever you are, iPhone 2, we'll be calling on you today, so to participate. So, you know, coming off the last couple of meetings, we've been focusing more and more on consent. In fact, our last meeting, we decided that after coming off of that conversation, really diving into MELD, that the focus of these calls really ought to be, how do we move that? How do we move this thing forward? How do we dial it forward? There's so many of the right people on the call here. As opposed to talking about it, let's talk literally about it. So we're going to spend some time today talking about some of the different components. You know, Dr. McCoy gave a great detailed overview of early intervention that, you know, is a great use case that works across the country. But we have, I'm sure, questions and things, you know, sort of reminders and things that we've been learning in different places. I'm interested, and I think Oliver's here today from MELD. We had a good conversation with IOI during the week and are looking at how to integrate the work that they've already integrated from Leap CDS and other stuff to be able to build and work from that framework. So we'll talk a little bit about that. Where this lives on open, you know, sort of the open applications, the open source stuff and standards. Obviously, we have more work to think about that. What are the kinds of solutions, Cadera and AWS and Magellan and all these different things that are now possible that we can really look at or begin to look at. And then sort of the business process, which, you know, kind of obviously connects to the early intervention use case. And learning from the great work that, you know, Point of Care and Pooja and Ed Daniels and the team at IOI did, putting together that use case, and really great tools around that. And how do we think about what we're doing to be able to display it so clearly? And then we'll spend just some updates on where we're at on some of the pilots and some discussion. So I've asked a lot of people to talk. It's really not a presentation this week. So, you know, questions that you have or thoughts, it'd be good to sort of self-manage the conversation for folks. But folks will, you know, sort of provide a little bit of update on stuff as we get forward, as we move forward on this. So it should be interesting and fun to spend the next hour or so together. And so a couple of updates. We just came, Christine and myself and Jim just came from a meeting with the CDC Foundation. And it's our second meeting with them. And the first one was great. And it just kind of hit it off. And this really fits with data modernization. And the CDC Foundation is kind of right in the middle of that, helping sort of be innovative and do stuff. And so Judy Monroe and Lauren Smith and others there are now focused on this as a topic, and they understand and recognize the importance of consent to accomplishing many things, but the centrality of it for all of the work that's ahead of us as a nation, really. And consent is the sticky wicket. If we don't get this right, everything else won't work, right? So that was a great call. I don't know, Jim or Christine, if you want to say anything about that, because it was real. It was. They didn't write a check, but we're getting closer.
Yeah, I would just add, I guess, that because, I mean, it was really cool to get into the whole Indiana connection thing too. Obviously,
oh yeah,
Judy was happy about that. But you know, with an expectation that there'll be continuing discussions between us and Brendan about you know, other applications writ large. It was great that she dived right in and said, "How much do you think you need?" And I think that's a reasonable target. And then get into the mechanics of structuring. I didn't get a chance to offer, but you know, between us, I would say part of our vision is that there would be some degree of self-sustainability. So 10 or 15 for stewards of change and supporting this effort, and then supporting getting it started with us is great. But I would expect other participants, just like our other projects, to provide in-kind contributions and resource support to at a certain point for its continued life cycle management of one or more solutions together. So.
Cool.
Sean, are you seeing?
Yeah, and I would just add, I mean, she got, after you dropped off, Jim, very, just granular about her next steps and her follow-up steps. So like, while Daniel said she didn't write a check today, that's because she actually has to go get the money. And I think after today's conversation with the, participation of yourself and with Brandon from her team, who was not on our initial call, I think it's really pretty crystal clear to her exactly what we're talking about and who to go shopping this to. So yeah, so that was pretty, not as exciting as being written a check, but pretty exciting.
Right. So that was good. That was a great sort of last step there. And it's great because there's a lot of overlap with foundations that know our work and have supported our work, including ones that have worked with us, our Robert Wood Johnson Foundation, Chan Zuckerberg Initiative, and others who are not that far away from or have overlap with our work over the years. So the names will be familiar, hopefully. And this is all also, I guess, another update is, and with Stefan on the phone, I'll just say that we're continuing to work towards a national workshop on consent, and that's a great target sometime this summer to be able to actually take what we're doing right here, literally, and translate that into helping support this national conversation. So that's a great next step and good timing for it, and will also help catalyze people to sort of focus on it. Stefan, anything you want to add to that at all, or?
No, we'll be coming back real shortly with a revised agenda. It's actually in my inbox for some final tweaks before we start circling back to many of you that we've already spoken with, but also specifically this group as a whole, because I know we have spoken to some of you independently. And so we'll come back with that kind of revised shared agenda to get some additional feedback. And then the work will start to begin kind of announcing it and promoting it and securing the speakers and whatnot. Many of you might be tapped to help either facilitate portions of the workshop or participate in them in different ways. Tentatively, if you want to hold the date August 16th, that is the date we are looking at. It's not 100%, but it's looking pretty good as of right now. We've kind of already cleared it through our contractor's availability to hold it on that date, which yes, ONC has to confirm with its contractor that they are available to hold our events, which I've never understood.
Wait, I thought that's what you said. I was like, what?
it doesn't register with me, but unfortunately that is the way that it happens. But also to make sure that we didn't have conflicts with any other major known events that we had going on at that time. Typically August is the month where we'd have the tech forum. We're going to do the tech forum a little bit differently this year and spread that out into September, I think over a series of Fridays and things like that. That's the current plan. Again, that's not public either yet, but more to follow on that. But it looks like August 16th, as of right now, is available, and we're close to confirming that date if you want to put a temporary hold on it. And it'll more than likely be in the afternoon. So if you want to kind of block off your afternoon, I don't think it'll be a full day event, although that may change depending on how we have to kind of move things around in the schedule.
That's great. Great. Stay tuned here. One other update, just a kind of a point in time thing, is we are moving towards, in terms of conferences, there's the European Social Network holds its annual conference, first time in a couple of years, in early June 7th, 8th, 6th, 7th, and 8th in Hamburg. And we submitted as a collaborative a proposal which got accepted and is on the agenda for a workshop, which will be supported with Christine, who will be there, and also Jim St. Clair will be there. I will not be there, but also Mickey Tripathi will be there, probably as a MP4 of himself, and hopefully, digitally. And actually, that's one of the things, Stephan, I was going to ask you is they have hard for them to do live video feeds overseas, time and translation stuff. Anyways, so that we're going to do a video recording with him. But it would be great if somebody could, if they could actually chat as well, you know, because that you can probably do easier without all the expense of setting up a whole video feed. I don't know if you know that from the conferences you've done when you brought people in from other parts of the country or the world, rather. Any sense of that?
No, but I could follow up with our global team who does a lot of the coordination around the Global Digital Health Partnership. And we do have sometimes where we, facilitate having them come in from other countries onto our feed and vice versa. Mickey's had to participate in a lot of those. I do know he is starting to look at doing some travel as well. So, his preference is still virtual first, but in some cases he is open to looking at some travel, of course, continuing to monitor the latest variants, impact on those types of restrictions and whatnot. But so some of those things may change as we get closer to the event as well. Who knows?
Well, that would be great. I think we'd all prefer to have him live if possible. So maybe
yeah.
And
is this? Yeah, I mean, I know he's got a couple international presentations around the same time. So I know that. But when is this one again? Because I know June 14th he's got a Finland presentation with the HIMSS European Conference. And then Denmark one, June 29th through July 1st.
So this is June 6th, 7th, and 8th.
Yeah, okay,
Actually,
so it's
Germany,
Friday.
right?
it's the, I think it's the 8th, 9th, and 10th, and our presentation is on the 8th.
Oh,
Yeah, I think that's still virtual, from what I can tell.
so good. Well, maybe there's a way to sort of have them pay. I don't know if they understand. They asked for have a a government person, and so he stood up and did it. So it'd be great to have him be able, because it's all of the EU, basically OECD countries, and they're dealing with all the same issues around consent. So the solution is actually a global solution. Just part of our conversation with CDC Foundation today was this literally applies everywhere, right? Everybody has to deal with this in even more stringent ways. So
yeah, are you working with Mitch on his participation?
Yeah,
because she'll make sure all those details get squared away as far as how it'll work, and then I'm sure myself and others will help on talking points and things like that. Current work, just kind of back up any kind of remarks that he's going to make. We'll help out with that.
great. So just to close the loop on that, so they have a whole timing process we were not completely aware of. So it's kind of expedited. So we got communication today. We're going to do it next week. So to get something in a can, because they actually translate all their stuff.
I'm sorry, are you saying with our side, our review for approval? And you're saying that it's
no, I'm saying Purdue. We were going to do a video because we couldn't do a live feed. So he said,
okay, pre-recorded.
Yeah, and so it doesn't need, and Christine, the whole thing is presentation is what, 20 minutes they want?
So actually just 15, it's an hour session. And so, yeah, so there's not a lot of talking. We should jump to that issue of the other 45 minutes in a sec, once we resolve this.
Yeah. So it's like just 5 minutes of, consent and how it connects to national models and data modernization.
But they literally need it next week. I forget what you negotiated with them, but they were very, very clear that it had to be done now.
So I think we're in good shape. I think we just got to put 5 minutes.
Yeah, if you're trying to get a pre-recorded video shot quickly, I'm sure Mitch can handle getting that done. We've done that before, so that they've definitely got kind of like the methodology. It's just a matter of squeezing it into a tight window where Mickey's available to do it,
right.
And making sure. The hardest thing is just making sure he's got kind of what words he wants to say, and usually that usually takes a day or two. Can be rushed whenever he tells us, hey, I need this by 4 p.m. We drop everything and we do it by 4 p.m. Like whatever.
Excellent.
Sometimes it's something he's completely comfortable, winging it on or drafting his own remarks for. And he's done so much work in the space that, he might be comfortable with it without having to get comments back from other ONC staff. But, if you haven't heard a concern or pushback from Mitch on being able to deliver, then I wouldn't be worried about it. I'm sure they'll be able to.
That's great. Well, I can't wait to talk more about that and how that applies to the August event and how do we sort of bring them over here, right? We can bring the our friends from Europe over here. They always like to come. So,
Yeah, hopefully we'll have it announced by then. So maybe it's something even that Mickey
Oh.
can plug. And you know, if we announce it after he's made his remarks, then, you know, maybe we can have him do like a soft announcement where, you know, he says like, you need to stay tuned for a workshop, and then you guys can reinforce like it's already come out and here's a link for it to participate, that kind of thing. So let's think about that strategically, how we can kind of work that into his comments and or through follow-up when you actually do the live presentations.
very exciting.
Yeah. Because by the end of this month, we definitely hope to have it, you know, announced.
Wow. Okay. That's great. End of the month.
Yeah, that should work then. That's good.
Um,
So Daniel, can we take a few minutes of people's time to talk about the highly interactive session?
I turn the floor to you, Dr. McCoy.
So having reviewed the structure, it is an hour-long session, but it really is intended to be a workshop. So it's not an hour of Jim and Mickey talking and myself talking. It's a workshop. So, you know, I really wanted to ask people to put a little thought into what is it that we would like to get from our colleagues in the EU countries. What type of input would be really useful? Are we asking them for, you know, examples of like specific examples of what they're doing? And there's the technology side, and then there's more the issue of like getting informed consent, right? That everybody can sort of buy into. And do you have to do that, you know, consent form by consent form by consent form that comes from every agency, or is there a more consolidated way to have people, you know, give informed consent to share across multiple programs? So I really was just, not that people need to answer it now, but in the next week or so, I think it would be very, very helpful to have people's ideas of what would you like to hear as feedback? Because I think Jim and I will have that opportunity to bring feedback from them. And what would work, if you were in the audience, what would work in terms of engaging you in this discussion?
You know what? I think we could take a minute. I just realized, if anybody's got an idea, stick it in the chat, because it's great. In fact, when you were just talking, it's like, what's different is that they have a single number for everybody, right? How does that affect the efficiency of their systems, right? So, and if you got an idea, just pop it in the chat. We don't need to review them all, but we can pick out some of them, right? That might be top of mind. Don't be shy. Take a second.
So Pooja did put the patient identification. So you're not worried about the patient matching, but you mean like from a security standpoint?
Well, I think it is patient ID and matching, right? Like how they handle that. Because from what I've read, and I don't know a lot about what they're doing there, but it seems like they have really good models around that, because I feel like that's kind of the starting issue, right? And so if they could share, you know, kind of starting from there as opposed to diving right into consent, I think that would be really important.
You know, that's, you know, there's a universal ID, right? And when we were talking to folks in Catalonia, that problem is not a problem. You know the person who is the person. They have health IDs, many of them do. Spain, Italy, France, Germany. I think it's actually one of the questions is, how pervasive is that? Because when you take that issue away, doesn't address consent. It actually makes consent more intense in some ways, I think, right? Because now you know everything.
So, I mean, it takes away the person matching issue, but there's still that issue of somebody's interface with technology, right? And how they verify that they are themselves in order to use that technology. Because if we're envisioning that our utility has a, you know, person portal aspect to it, right? Where the person can get on that portal, review the consents that they've given and make alterations to those consents if they so choose. There has to be a means for them to do that as well, and to prove and to show who they are.
Yeah, so I'll have to go back to the paper, because I know we had some references in the work that we did. A couple of them studies actually came out of the EU. So Christine, I'll go back and look at some of those and send you some other thoughts once I've had a chance to do that. So that one of them was this portal concept, right, of being able to go in and do that. So I'll take a look at that reference and send that over and some thoughts.
Mhm.
Hey, Rita, what do you mean MPIs don't always resolve matching issues?
Can you hear me?
Yeah.
Yeah, no, I mean, there's like countries like, United Kingdom has,
You're a little garbled. Actually, you're not, it's a little hard to hear you, actually.
okay.
Try it again.
I'll try to type something.
Yours good. Now you sound good. I don't know if you.
Oh, I do?
Yeah, now you sound okay. Don't move.
Okay.
That's
Okay,
better.
I'll try not to. No, the national like health service, like in England, they have issues because even though they have like a national ID, they have different regions that don't always aren't always like linked from what I understand. And so there have been issues that have documented with not always necessarily being interoperable, some of those like ID scenarios. But I can also try to like dig out some old work or research that I had done when I was into this.
That's great.
And I would just chime in, Matt, I see the questions there on privacy and consent. Good question. Most of the EU effort right now is around like the digital identity wallet concept, but they leverage existing national identities that they have. Consent is construed as part of privacy and data protection, but for my conversations with a few German health, they don't have a 21st century Cures Act type data model to work with. So, you know, who owns patient data or how patient data is controlled is a separate argument from the GDPR consent to share, right to be forgotten sort of argument too, and there's some, bifurcation between them.
Yeah, I totally understand that these are different, slightly different problems. They're just so much more sophisticated than we are in terms of their emphasis on privacy in general, like broadly speaking. So I was just I was trying to think about how much of their landscape is translatable to the United States and vice versa, and the differences. And because they are passing these privacy and consent laws, they might, that might be some kind of pathway to a technology that could serve as a consent utility, because you're dealing with, many of the same things. You're dealing with who is this organization, what types of information is being sent here and there, what is happening, kind of like a technological system acting in the background. The other piece that I was thinking about is in the United States, the big question is governance, right? What organizations are at the table? Who is at the table? Who is governing this entity, right?
Wait, which entity? What are you talking about?
A consent utility. If consent utility were set up in the United States, and I think this is really one of the greatest opportunities for Project Unify is not just getting the funding to build something, but to think about how once something is built can be extended across jurisdictions, and who is at the table in governing this, and how can it be extended, and how can each of the players be incentivized to adopt an extensible consent utility, not just extensible in the technological sense of its open source code, but extensible in terms of who has a seat at the table. Is this entity, this governing entity, trusted? Because without that, you're not going to get either participation from individuals wanting to use it, or you're not going to get organizations participating and extending it. So I think in Europe, some of those questions may be the obvious answer is the government agency because they place more faith in government. In the United States, an external nonprofit may make more sense. So anyways, those are some of my thoughts.
Thanks. You know, years ago when I started doing more of this work, it was interesting that I don't know if I mentioned this in the last call, we were talking about this, what do we learn from Europe? What do we learn from OECD or EU, whatever? And then it's like, oh, the United States is so big, right? It's like 350 million people and got all these other countries there. It turns out that I was just having to Google the size of the states, and I discovered something just for a moment. How many states in the country have less than 9 million people? Fix the number in your mind. 39 states. So most of them are smaller than most, like Sweden and Switzerland. So, you know, the scale of things, well, it's a country versus a state. There is scale kind of comparisons that are interesting there. And there's a lot more experimentation because there's a lot more decentralization and concentration. So it's a good place to look for models. And Finland is one of those places we had at the NAA that talked about some of their stuff that was, you know, again, it's a different context, but there's some learning there, right? That is possible. And there's all these countries that are doing, you know, great stuff, right? So it should be I think hopefully what we're learning here is transferable there in some ways, right? And that there's global learning that's happening. What a cool thing that would be, right? They have more mature, yeah. I think that, yeah.
So how do they enable that? I mean, I think that's one of the questions, right? Is you've integrated it, they've had to solve this issue of moving the information around.
Well, I think they would say the interoperability challenges are still there, you know.
Well, not the interoperability. I mean, I literally meant the consent. I'm sorry.
Oh, yeah, consent.
They might be moving the data around on paper, but but they had to get approval to do that. Or is that just, I mean, given their focus on privacy, I assume that extends to things like their child welfare systems and you know, social insurance systems and things like that. But I know.
Right, there's a lot more of that, right? So
Or is it, well, you got all of this from the state, so therefore the
Right.
state is allowed to share it amongst itself.
Right. And then of course there's the original I think it was called the Belgian Bank, right? Belgium was one of the first countries that said, we're going to ask for your information one time. And we're going to centralize it and we're going to federate it. And amazing stuff there. So Belgium, yeah, there it is. Great, thank you. Right, that was one of Martin Dugan's favorite stories early on, right?
And do we know that that's live and working and turned out the way they expected it?
Somebody Google it quick. It's a model though. They broke the mold.
It is. It is actually. Yeah, it is live and it is working. You can look it up. And it has expanded over time. What it is though, is it's not so much data sharing as it is data pushing. So the government mapped everywhere that your data exists. And so anytime you update your data in one location, so like with the Department of Motor Vehicles, let's say, your information gets updated everywhere else. So your licensures or anyone else who has your data would get updated across over 3,000 different government departments. But it does that based on a series of rules. And the bank is the rule bank.
I was wondering where the bank came in.
And did people have no option about that? Like that's just the way it is?
Now, this is just government. The idea is you only have to give your information once, but this is just your demographic information. They're not sharing that, you know, you've got X number of traffic tickets or that you haven't paid some kind of fines. They're sharing the basic information that they already have on you. So I'm not going to get your address unless I know your address. I just get your address.
Mhm.
That's kind of an interesting model for consent. And maybe it's
Well,
close.
there's no consent because you
No,
already
I'm just-
gave, yeah.
Considered
No.
a convenience, right, to people that they
Exactly.
don't have to go and update it every single place. It's done for them, which is a convenience.
and
Yeah,
then-
but it's not really data sharing. It's just because there are no sharing relationships between the organizations.
Yeah, that would, if it was extended across, multiple government agencies, that would do a lot of benefit for access to government benefits. I know that for healthcare, the state health exchanges automatically tap into like IRS income verification, but it doesn't go a lot beyond that, except for a few state pilots that have gotten individual authorizations for co-enrollment of SNAP and TANF, I think, along with Medicaid and health insurance subsidies.
Well, this is just reinforces how there's always stuff to talk about. So I think that maybe this is actually a good sort of segue into kind of the four topical areas here in terms of the use case kind of meld. Anyways, the four things that are on here. Just to sort of roll the conversation into that, I know, Christine, you had, as I said, given a pretty thorough overview of it. And I think that's recorded for people who want to hear it. And that'll be good, useful stuff, hopefully, for the modeling that will happen. But we talked last week or so about identifying those few places where consent actually would be needed or helpful, and how you could actually point that out in this really robust use case that actually has a funding stream that every community touches. So it's actually a great mechanism for sustainability, right? So do you want to say more about that or different direction?
I think I can just summarize really quickly. So with this very specific use case, I think, it's pretty clear that consent is absolutely required for any and all data sharing, but the data sharing that would occur. So I guess I'll talk, there's, bidirectional, right? So in order to pull information out of, for example, the medical care system or say a child care system into early intervention for the purposes of doing the child's evaluation, there's no federal law or state laws that I've seen that would enable that to occur without consent. There's no exception to HIPAA, for example, for that to happen. And then, although there's, debate within some of the states that we're talking about is, whether EI is a covered entity, it's technically a hybrid entity, because they do bill insurance, but not for every individual child. And in fact, that one area where the parent does have to give consent is for their insurance to be used. So they can be insured either publicly or privately and refuse to have that insurance used for early intervention services. And under those circumstances, the early intervention agency has to still pay for those services, not using that child's insurance. So anyway, that's got a little bit of an aside, but to pull that information in, and then there's essentially three categories of data that can go back out. So there's essentially the outcome of an initial referral, meaning does that child qualify for or not qualify for early intervention services? As just a binary piece of information that could go back out, that definitely requires consent. And that's one that it looks like some places are considering right now, but also there's the actual evaluation that occurs, and that I would posit should be shared with certain parties. So they would need to consent to send that out. And then once they have a individual family service plan, that's another essentially a document for those of us in healthcare to think of as something like a CCDA at its simplest. And then there are Q6 month updated reports on that child. But again, for any of those to go out, consent is required. There's nothing in statute to say that a blanket consent for all of that could not be given at the beginning of services. So that is certainly one approach versus, at each one of those steps along the way, consent having to be, or it could be asked about again. Say they said no at the beginning, you could ask about it when you get to the next component of information that could be shared. And the last thing I will say is that there's nothing about sort of sharing basic demographic data, kind of like what we were talking about with the Belgian example, or anything similar to that. There's just not, it's just not mentioned in any statute or any policies that I have read to date. So even to sort of acknowledge that you have information about that child, whether or not that's identified as coming from early intervention or not, it's just not something that anybody has put in regulation or policy that I have found.
So Robin has a question, and I have a question on that.
Thank you. So in the use case that you're describing, is there any difference in what you just described when you're dealing with the scenario where the child is a ward of the state and basically in the state foster care system?
So
And
it's pretty clear that that whoever is legally responsible for that child has to give all of these same consents. Yeah, that was very clearly spelled out in the federal regulations.
Thank you.
So one of the things we, Christine, we were talking about was, are there places where, while it may not be in statute, but it would be really easy to, it would be easy to show, right? It would be a relevant exercise, especially if it was, synthetic personas that we're creating, right? We're not necessarily looking for those folks. Because that information would be useful to education, right? At some point, it would be useful to know, it'd be able to transfer.
Well, that's the final step, right? And that also, it's required that a meeting happen, but they don't talk about what documents have to be exchanged at that meeting. So
okay, but that's something that education, it's kind of, as we said, it's kind of FERPA light. Right?
Yeah, and it's a formal transition from this FERPA light piece of the education world into the real FERPA world, which would be the pre-K side of the education, the local education authority. And so there is supposed to be transfer of information about the child. And again, the parent has to give consent for that to happen. That is very clear.
Right. And that happens early, right? That's two, you said, I think it was 2 1/4.
It happens starting at 2 years, 2 1/4. Yeah.
Right. So it's not a window, it's not a long window of time at all. It's like, you got to get that done.
Right.
Right.
There's 6 months for it to happen because it has to be completed by 2 3/4. So yeah.
Right. Well, that's great. So I think we can, show that, and, places where it's, and then obviously the other interactions with all the social different programs can be.
And it's definitely a source of frustration in the real world in a lot of places because it doesn't happen well right now. The emphasis has been on putting together these in-person meetings, and those are very, very hard to make happen even pre-pandemic.
Yeah.
And so it just often falls apart. In particular, a lot of the families, that's just not something, they can make happen. And then they're thinking about moving. There's a million reasons why it doesn't happen well. So it is very important to the education system to streamline that. And it's very important to the child's primary care, and in some cases, specialty care, subspecialty care physicians, because they, obviously want to know what the child's evaluation has been and what services they're receiving. Big picture, but sometimes they're also being asked to sign off on orders for health insurers to pay for those services, and they don't have the context. So they're writing an order for something that, you know, they really shouldn't be, because they don't know why they're writing that order.
Right.
You know, I would just add, in some of my experience working with early intervention entities, non-medical, if you will, they don't exist with digitized platforms for data collection in many cases. So, I mean, I think in terms of even operationalizing the things that we're describing here, you know, you still have entities that are not digitally equipped.
Yeah, it'd be good to have a sense. I mean, the two of the states that I've been looking deeply into, Colorado and New York, are literally implementing brand new systems as we speak. But you're right that there are probably many around the country that are very challenging to.
Well, let's not forget, New York has just gotten universal pre-K in the last administration. It's only a couple of years old.
That
So,
too. Yeah, but I mean, we have to get consent even if we're going to exchange the materials on paper. So, but it would be nice. And in fact, if they have, it's better if they haven't updated their systems yet, because if we could have this in place before they do the architecture of their system, then it would be easier to specify what that data should be that will be shared and how it can, be transmitted electronically. And unfortunately, I can tell they've put these systems into place with no thought about that whatsoever. Like literally the only thing that the system seems to be capable of saying is, yes, child qualified for services. End of story. That's it.
You know, I think if that is the one thing that this group, Daniel, can have some further discussion and strategy around is being able to be brought into those conversations to actually be part of planning that. So, I mean, I absolutely agree, Christine, with that method. It's better to be part of the conversation early on as they're rolling these systems together. I can tell you a primary example of where this isn't happening right now is the entire rollout of 988 and the crisis system around the country. There's been an incredible amount of work going on, standing up the clinical model of how a call center is going to work, how mobile teams are going to be dispatched, how maybe you've got a psychiatric urgent care center. Nobody's talking about the technology necessary to have interoperability between those entities. They're not. And so it's truly an afterthought. That switch is flipping on July 16th. It's going to be something that will be under development for many, many years. So to the extent that with this conversation, to your point, those systems are not there yet. But I mean, if you could inform and guide and help structure the way in which they do set up their methods, their platforms, it's so much better off. I think the challenge is how do you get these technology conversations early in sort of systemic development?
Well, we'll hopefully have that opportunity with our pilot programs and our MVP.
Yeah, and I was thinking about that, a big focus of the work happening in Colorado right now is that of behavioral health. And I don't know the status of their mobile crisis response system, but and then for sure the 7 remaining Inc. projects, this is something that they are required to try to integrate. So though that's 7 places around the country that are trying to figure this out.
At least, right.
Yeah.
Yeah.
I mean,
in terms of this much larger context, because it is one of the super emphasized elements of Inc.
Very cool. Actually, that's a great segue to Oliver and Mary Sarah and everyone who has a dog in the meld cauldron, as it were. How are we going to how is this going to fit? The last conversation we had last week, the good news is it's like these trains have been moving together for a while now. So it's like another turn of the wheel, in the sense of some of the personas that we worked on, and actually, Christine, you worked on some of them that were actually in the IOI universe, And I think, Oliver, if you can update us a little bit on what you're hearing here and how kind of the work you're doing with that, and then this idea of synthetic personas might be able to sort of demo this going forward. Floor is yours.
Sure, thank you. Yeah, so if for some of the people that are new since the last time I've been here, it's been a minute or two. I'm with the Interoperability Institute as a senior product engineer. And my team is responsible for innovation, and we've been developing a community that I know Jim St. Clair is aware of and is participating in, as well as some other groups. But we really have the goal of bringing healthcare and healthcare related systems. Sorry for the lack of the proper term there, but like consent utilities to the community for public testing, evaluation, development. So one of the first things we did is, if you get on to Meld, and I'll put a link in the chat when I'm not talking here because it's hard to talk and type. But we've put the LEAP consent decision service backend components into Meld, so you can test that out on any of the sandboxes there. So that's one of the ways we're trying to participate. But we're also looking for new projects, initiatives to engage the community with, to build interest in, and we're happy to deploy those, add them to the tech stack so that the most people can test them, as well as providing a set of synthetic data for testing and validation in the form of personas, or if we need a larger data set, we can generate that as well. So the community is really focused on delivering value for their communities of practice, and consent is one of the biggest areas that we've got and are interested in pursuing. What did I miss? I give the same speech so many times, I sometimes forget what I've covered and haven't.
Well, the synthetic personas, I think those are really powerful because it gives you the ability to have that longitudinal view and test it at a very low risk. And I think a lot of organizations, it's kind of a chicken and an egg scenario where they're not allowed to go forward to even develop the solution until they can prove that the solution would work. So if you can do it with synthetic data in a controlled environment, that creates at least a moderate level of confidence enough to get a go ahead to, all right, it may be worth trying.
Yeah, thanks for that, Marisara. So that's one of the things that we've spent a lot of time in, is developing personas for that, as well as, one of the goals is to get this sort of technology out to as many people as potentially possible, so that they will invest the time and effort in finding the faults and improvements to kind of curate the project and bring things forward.
So so that's good. So the thing that's on my mind now is, the use case and the scenario and the various personas that we developed for the Thompson family are, they're still a Thompson family. And they are, they represent, sort of deep end set of clients that are doing stuff. But we now have and maybe we can actually mold the daughter on with the early intervention. There you go, right? Perfect. Yeah. Okay. So check that one off. Your microphone's not on.
I'm just saying she needs to be 2 years old, not 3. We keep
Okay.
we keep advancing her to being 3, and I keep saying no, she can't be 3.
Now we know why.
Yes.
We thought it was just, you like them younger. Is Brian, Brian must be cheering. Brian, are you cheering there? Yes, I thought so.
Wow.
But that's a great way of actually taking that, Oliver, because we have a really robust persona there that now can become the use case, and then we can sort of attach the BPM plus stuff. Pooja, are you still on with us? Are you there still? She was on.
No, we lost her early on. She
Okay.
actually dropped off a long time ago.
Oh, she did. Okay.
Yeah, but I mean, it's right. I mean, the Thompson family, we've got child welfare, we've got every aspect, I mean, in there essentially. I mean, so it's a really good start. But I don't know how much of that, like Madison, I don't think is built out very extensively. Her older sibling and the adults are much more built out.
Yeah, that's great. Actually, I can see
Madison's hour has arrived.
I can see the panel now. Before we end today, I'll show you one of the graphic panels we did at the NCPDP conference this last week. We did 3 panels actually, which were really cool graphics. So, so that's great. We can do that. I don't know, Oliver. One of the follow-up things is to really think about what that form looks like. Maybe a tiny bit early yet, but looking at the use case and looking at what do you need in order to make it applicable? How do we apply the MELD technology? What is the use case sort of artifacts need to be? You follow what I'm saying? How many personas do we need, to represent the socioeconomics of the country? We could probably do that fairly easily. And then create how many thousands of people, or hundreds of personas behind each of one of those sort of demographic groups. So that shouldn't be that hard, I don't think, right? That's a question, Oliver.
Yeah, I think that's kind of the way forward is, kind of what the personas look like, what format are we going to put data, how much data do we need to test the specific aspects, and then what are we going to model that data after to generate, the most realistic personas. It sounds like some of this could be captured in the BPM work, but as well, maybe there's further work that could be integrated into MELD. We're working towards integrating modeling tools into MELD. It's a work in progress, but there's other ways to represent kind of this change. We could create a series of personas for the family, modeling different aspects or points in time along those lines. And I think there's a lot of different ways depending on what direction the project is taken.
So would it make sense that like we would need personas that are essentially receiving a different baskets of services, right? To sort of try out the consent moving from a particular service line or consent regarding a particular service line's information being approved to be shared with another service line. So that's like a little more than demographic. So they would have to say like this person is, is on probation, for example, or something like that. We don't have to have any details because we're not sharing the information, but we need to show that we can do the proper consent of some information that comes out of that justice system.
Yeah, I think that's definitely one way to look at it. I would definitely caution against maybe the traditional persona model of trying to get everything in the kitchen sink into a persona, and maybe more of a kind of a scope persona based on each of the I was going to call them units, but this isn't software. testing, but maybe the group knows what I mean here, but the different aspects or facets of the problem.
Yeah. And I think that's what we have, the Thompsons that are the kitchen sink, right? And then we could build out a larger number of much lighter personas.
I love the idea of having like 10 to 15 data elements, that you need for consent, right? Maybe that many, maybe 20, but not thousands of things, which is kind of cool.
Right.
So that's great. Thanks. So that's marching along. We also had conversations over the last week or two about sort of some of the technologies, right? And the applications that are available for doing identity management, proofing, ledger kinds of things, transport. And so Jim, that started to come up in our weekly calls. So we have a weekly call with some folks who mostly focused around the New York POC to try to move that along with Paul, and I think Paul's on the call here with Kathy and the New York folks to just keep momentum there around getting that ready to go. And so in that conversation, there was some discussion around, hey, there's some options that we should think about in the open source world that can be brought to bear. So since then, what's on your mind relative to that? And does this move how do we move that forward? What we're thinking about.
Well, it's like we discussed with Brandon and Judy today, that there are a plethora of open source projects to use that allow granular levels of consent for data architecture that are far more sophisticated and potentially onerous from a policy standpoint to implement, but they exist, so they're out there. So it's a matter of, I think, kind of getting those all together and then using those as the basis to say, here's our various architectures, what do you think? Or what do you believe the next steps are? Probably in line with those various synthetic personas that we want to use. And I think to that end, that's what Oliver and I are working on with regards to MELD and having the synthetic personas, a portfolio of tools, and then exercising various workflows, potentially mapped to a BPM plus workflow model.
How quick does that happen? Obviously thinking about, and this is just a general question, is how agile can we be if funding comes in? And we certainly hope to fund this thing in a way that makes it, doable. Can we do that? Can we get this off the ground in 3 months, 6 months, 12 months?
3 months, yeah, I'd be comfortable with 3 months. Mainly because it's not entirely shelfware. I mean, these are all open source tools that have been applied for other similar uses that have a life cycle behind them. It's a matter of getting them oriented to the right environments, probably in AWS, and getting them stood up and running, and then applying governance rules and workflows.
Yeah, I guess I'm interested in thinking about the other work streams as well that have to occur. So can we get something done in 2022, right? Can you actually, especially if you think about the legal and the policy framework, and you think about the governance, and you think about the UI, and you think about, all the unexpected kinds of things that are going to, emerge as we do that. I think yes, but I'm a eternal optimist on these things.
What I don't understand, and you and Christine or Mary Sarah could correct me, is like for the Bronx Rio case, after all these discussions, do we have everything written down in terms of a process flow, a step 1, a step 2, given case A, we need consent 1, 2, and 3, and what that looks like, because that's what comes down to rules that go into the software.
Yeah.
And what systems are you integrating with? Obviously, it's going to be a big piece. Is the idea that are you integrating with like some kind of statewide early intervention data set, or are you doing it system by system, or et cetera?
Yes,
No, I think it's less about the systems you're integrating with than the ability to manage the data of those systems. And is that capability mature, or are you
Yeah.
developing that in parallel? Because the consent does not provide the data management capability across the board. It's just one component of it. So it can add on to existing capability, but if it's not there, at a granular level, and in most of healthcare, data is either shared or it's not shared. But now that we're mixing data, we need to get a little bit more granular than that and be able to say, well, we can share this part of the data, but not these other parts. And that's a new capability, I think, for a lot of data sharing organizations.
Yeah, good point, Mary Sarah. And Christine has rightfully pointed out we have to be able to address paper workflows in some cases. And maybe
Yeah.
that's part of a minimum viable product. Maybe what we want as a stretch goal with a version 2 is we integrate completely with a Gravity project workflow to be able to move everything in Fire, or to transform it in Fire, move it out of paper into electronic data, and then associate a consent workflow with process flow with that.
So I think it would be really interesting to Oliver be able to use like the Interoperability Institute or something like that to be able to stand up some synthetic use cases that people could explore and see how good a fit they would or would not be for different situations that they're looking at, and poke holes at it. Kind of, I don't know, like build it together, if you will.
Yeah, that sounds like a really good use, especially since, Jim, it sounds like there may be a few options that are of competing quality to solve the problem in the open source space. We could build some consistent data persona models around it, and then use it as a level playing field.
I would just add, if anyone is interested in some of the work that I've done with health information exchanges around data exchange for 42 CFR Part 2 data, I have a number of use cases that we had identified when we were architecting the consent models for those HIEs. If that would be of any help in this conversation, I'd be happy to share those use cases.
Great.
I think it's a great idea, Robin. We'd love to see it.
And Jim, to answer your question, we're trying to have that done. We have a meeting with the New York State early intervention folks coming up on the 23rd. And so, and then a follow-up with them 2 weeks later. So no later than that, should that all be, or a week later, should that all be nailed down. We sort of, we can read their manuals, but we have to find out how it works in practice.
Yeah, I mean, there's tremendous upside to it because it lends itself to robotic process automation and capturing the paper documents into electronic data. And then that electronic data goes in a repository. And then we have the standardized work that Brian and the team are doing, and then we share it out. So, but back to your original question, Dan, could we do something in 90 days? Yeah. Will it take a year to sort through optimizing a lot of these processes and converting analog into digital? Certainly, regardless of what location we choose, I think.
that's encouraging. That's great.
And Stephen, I would throw out, I have a slight concern because I know CDC is running ahead with its new Gravity project extension around SDOH that they're doing with EMI advisors. And I just voted on the business case for that. It's a good business case, but it's got SDOH all through it. That needs to hear about consent sooner rather than later, since it's looking at those large data sets of SDOH related population health data and where those come from. The same sorts of things we're discussing here. Issues of early intervention and child welfare and stuff aren't mentioned in that business case as yet, but they will be ultimately teased out as part of data flows.
Well, and I would add to that regarding the Gravity model, the concerns of a lot of those databases don't align with the current data flow that's going on the ground. So there's some significant disconnects. Also, Gravity is really looking at the application of the codes from a healthcare perspective,
Yep.
not from the community-based or social care expertise perspective, which I think is a significant issue, given who does most of the social care in the country.
You're,
So I
you're
think that-
exactly right, Courtney. Yeah.
So I think
Yeah, it-
that's something that, I'd love to have a conversation about here, as well as what, I apologize, my dog decided he needs to attack me right now. As well as what type of use cases do we need to be looking at specifically for organizations that may have a more difficult time engaging. And I mean, if we really want the rubber to meet the road, we need those organizations to be able to play and align their data through this technology.
That
And
was
I-
something that Judy Monroe was really interested in that discussion we just had with her, that, bringing in those community-based organizations that, so glad you brought that up too.
Well, and what I will say, the other piece of that is you've got networks like the AAAs, but then you've also got the CBOs that have even less capacity.
Exactly.
So, there's a couple of different groups of entities to engage. And I think one of my big concerns when you get to Gravity, when you get to a lot of standards groups, is that there's certainly ours, there's other national networks that have associated funding, regulatory, and other requirements attached, that I don't think any of the landscapes are understanding some of the realities on the ground and how that's going to impede potentially data flow or impact it. And there's been no discussion of funding and investment in the social care providers like there was for the healthcare providers back when the HIEs were born. And everybody acknowledges that that is going to automatically, on the back end, cut a lot of these service providers out and really empower the healthcare side on social care, yet they don't do social care. So it's a real disconnect, I think.
Yeah, this has come up in a number of different places, but two things. One is that, I appreciate all of you bringing that up and talking about it. If this group wanted to try to summarize some of those thoughts and provide them to me, then I can either officially kind of like bring them to Gravity's attention as feedback we received, whether we name this group or not. We can do it as kind of like we've received feedback like this from interested stakeholders and not necessarily call it out, or referencing specifically it's coming from this group. Or we could also even just through the role that we have in funding some of Gravity's activities and working with CMS on the activities that they fund too, look at ways that we can try to address some of these things in the requirements we have for the work that's being funded, right? So there might be ways and levers where we can kind of softly nudge this to getting addressed, because I think it's not for a lack of, I think if it's not for a lack of like wanting to do the right thing, or it's just probably moving without thinking through all these things, and maybe some of it is being thought of and it's just not apparent yet. But so that's one thing, is if you wanted to summarize some of these things in writing and email it to me, and then let me know at what level of comfort you are with me kind of carrying those forward, I'd be happy to do it in a number of different ways. And then the second thing is on the CCHI initiative out of the White House that I believe many of you are familiar with, the Community Connected Health Initiative. So I don't know if everybody saw, but they just released a summary of the findings from all the roundtables that came out, I think, last week. Did you guys see that yet?
No.
Okay, I'll drop the link in here shortly, because I can't multitask, so I'll wait till I'm done talking and then I'll drop the link in the chat. But they did release kind of a summary, high-level summary report of the key findings that they got from the RFI, that they got from the roundtables and listening sessions and other engagements they had on it, and the fact that they're still open to receiving additional feedback. But I'm part of a small group working to make executive action proposals from this administration to try to address with that. And I can tell you, capacity building, specifically resources to support institutions like the ones that you're talking about with this level of technology adoption and standards work and so on, and be able to participate this time around not like what happened when HIEs in the private side of healthcare was really subsidized more so than the social and human service side of things. That is something that is explicitly kind of like called out, and I don't know if there'll be like a specific action versus a recommendation or proposal that'll have to lead to some kind of collaboration with Congress and others to identify funding for stuff like that. But I do know some of these things are in the works. ONC has had proposals on the tables for years to try to address some of those issues. We just have been flat funded for so many years that we haven't really had the flexibility to fund new things like that. But it continues to be something we try to push forward, knowing that that's an issue, right? That there going to be these other service providers at a community level are continued to be left behind because they don't have the resources to adopt new technologies and to move in this direction. So definitely it's something we recognize, and I'm hoping that through this one White House-led initiative, there might be some policy actions and potentially even funding actions that come out of it. Remains to be seen. It is a heading into an election cycle here with the midterms coming up later this year. So I think the goal is to get those executive actions out before the end of the summer, so then it doesn't get swept up in any of those kind of political headwinds and budget negotiations and all those other things that kind of take place at the end of that year. But fingers crossed that we'll be able to get those out by the end of the summer.
And Stefan, I'd add, I'm more than happy to send an email, just a quick introductory email, kind of start chamberish between you and me and Daniel and Gabriella as PM for the CDC SDOH effort, and Evelyn or Linnell, or Evelyn and Linnell, and we just kind of have a quick call and say, look, this is what we're working on Unify. This is where we see gravity going. This is the area from Unify that we see not being addressed in process flows and the data, and just most importantly, we can start building stuff in with either, well, and to that end, and I think to what Courtney was saying, gravity is much more provider focused clinical care delivery. I'm seeing the CDC SDOH gravity subgroup as well as HL7 Helios being much more public health authority, and as such, being much more on the ground connected with the CBO or behavioral health, et cetera, et cetera. So if we insert ourselves into those conversations earlier, especially since Alterum is just getting Helios rolling, we could probably do that. So.
No, that's a great idea. I think, of course, how you word it always, is always helpful, right? So, rather than saying you identify, gaps, or, rather than saying something like, we've identified some opportunities, so there's, it's all in how you kind of grease it.
Here there be dragons. That's right.
Yeah. I can tell you, Evelyn and I have spoken in the past under the context of the Fire at Scale Task Force, and she was really, looking for FAST to kind of help her, think through what are some of the core infrastructure needs to support kind of the work that they wanted to do, and thinking through best practices for identity management and a lot of these other things. Something that FAST wasn't able to really address early on, but always wanted to get to, was the issues of e-consent. Both the identity and the security tiger teams identified that as a key area. They both tabled it to be worked on at a later time, but it is something that potentially again, it's a gap that people are still trying to fill. So that's something that we hope that again we can highlight that opportunity for greater collaboration on these things during the workshop. But send an email like that. I can help connect the dots. Obviously, I've worked very closely with Linnell and Evelyn in the past, so happy to help.
Hey, Stephen. Is ONC kind of engaging with other government, other federal, like non-HHS federal government agencies around essentially putting grant money that would attach, would essentially require the use of standards? Because what we're seeing, for example, in New York, like New York City, for example, contracted their Department of Justice. I forgot what the city agency is called. They ended up going with NowPow, I believe. And this is the kind of thing where it's like, if they had put a provision in the RFP that said, NowPow must adhere to fire standards, and anybody in a neighboring, if Open City Labs is on the, some healthcare organization, or we're with the food pantry organization, now we can interoperate with the justice people, right? So is there other conversations? Because so one strategy is to essentially try to get the people who are at the community-based organizations of
Matt.
justice at the gravity conversation, and the other is to like kind of do the reverse way around, where you're trying to get funding agencies, and that will drive participation in the standards entities itself. Does that make sense?
Yes. So there's three things that I can say to kind of address your question. So number one, ONC is the principal federal health IT, coordinator for the federal government in general, right? So we manage something called the Federal Health IT Coordinating Council, which has 40 federal agencies involved. Half of them are HHS. The other half are all the others, right? And we're supposed to be the coordinator. How much we've flexed our coordinator muscle versus kind of like requiring things and so on in the past has been dependent upon who that coordinator is. Mickey is very assertive in that role, where some others maybe were less so. But typically when it comes to things like contract requirements and grant funded opportunities and things like that, the history has been that typically we've gotten involved when we've known about it. And if they've sought our input. And there's certainly been a lot of missed opportunities where we probably could have recommended inserted language, things like that. But it was not like a hard mandatory, procurement requirement as part of like getting the RFP to go out. Did ONC review this for, because it checks a box of being health IT related? That is something that hasn't existed in the past. So we've done it in a lot of cases, but it's only been like when we were consulted on it, or if we found out about it and we're successful in being able to nudge ourselves into the conversation and get that approval into it. So the first thing is like we play this official role in doing this kind of awareness and so on. As far as like review of grant funding, we've got some history, but it's not been like a formal process necessarily. It's been more ad hoc. The third thing is that we are working with the secretary, this current secretary's support. We are currently trying to put some of that structure into place, but it is still, I would say, kind of pretty early in the discussion. I mean, we've thought through kind of like what would trigger our review and things like that, at what types of levels, what are some of the definitions for when we need to be involved, to where we can insert some of those kind of requirements around use of specific standards or point to other things like that. And that would, start with HHS agencies, which is obviously a huge spend, and has a lot of, procurement levers that ultimately would kind of, create a lot of community-based, impact. But then also for like non-HHS agencies, that's something that I think as of right now will kind of be like a second stage to that if it's successfully proven at HHS. But we're still kind of working through all of that.
Stefan, that was, as you were saying that was great to hear that, because in the Inc. RFP or the NOFO, you guys, I learned actually provided the interoperability language. So
we've done it in a lot of cases. Yes, we've done it even with the, some of the RFPs for just even, solicitation of like, information, or RFIs, I should say, that go out. A lot of times we do insert quite a lot of technical content and specific questions. We work with CMS quite frequently, but also in the past, sometimes if like CMS didn't want to run it by us, like there was nothing that said that they had to, right, necessarily. And so the secretary or others would sometimes be put in awkward positions where we'd say like, oh, we need to be involved in this, and here's the reasons why. And generally, like I said, it's in some agencies, it's going to be business as usual, just with a little bit more kind of guidance to kind of trigger and make sure things aren't slipping through the cracks. In other agencies, it's going to be something new, and they're going to be concerned about, is this putting additional, red tape in the way of something that they're trying to get done and get out. So hopefully it won't be met with that, but these are things that, we're pushing for internally. We're starting with HHS and, getting with the support of the secretary, and, we'll expand it beyond that.
I'd throw out as a potential trouble spot, and not to sound like I'm complaining, but I think is a good thing for us to take action on. And that's IHS is charging ahead with their HIT modernization. And there are, as you all know, right, there are real live restrictions on individual Indian health data and how that's governed by the tribes, that consent has to be built in. And none of this has been in any of IHS's efforts to date.
Yeah, we do have a relationship with IHS, and when the CTO's office was around, they were involved and definitely pulled us into a lot of the conversations, and we work closely with them on, some of the stuff. But again, it's been mostly like in an advisory capacity, and they kind of like take what they want and don't what they don't,
Right.
But there are some challenges there too. A lot of people don't realize IHS, Indian Health Service, right? A lot of people don't realize that there's this kind of like the segmentation of the Indian Health Service agencies that are run by and managed by HHS. And then there's the independently run ones that opt to take the funding from the federal government and run their own.
Right.
And so there's this kind of disconnect when you look at this between the IHS, different providers out there, that some are underneath a network that is run locally with federal funding because they've taken that option. This was something that I guess that was like kind of permitted when it was all set up, was like they could either have it, opt in to be run by the federal government or just get the funding and kind of do what you want.
Right.
And then there, we've got control a little bit more. So when I say we, HHS, over the ones that have opted in, have us run it for them and it all be centralized. So that does create some complexities as you try to kind of roll it out,
Yeah, particularly if
IHS
you're
wide.
trying to procure one uniform contract for Cerner throughout the entire agency.
Yeah, right,
Well,
right.
the other thing is you have 220 tribal
Yeah.
aging programs that fall under Title VI, Native American aging programs, that's where their social care sits, that has all different data.
So Courtney, I'm going to publicly ask you, when are you going to spend some time talking to us center stage on aging? Because
Yes.
you have successfully kind of intrigued us in terms of a whole nother 60 million cohort, of which I proudly am a member. But so I'm gonna publicly hold you to a date. I've been trying to get her to talk. Don't think I haven't been trying, folks.
You've been very patient, and I will admit that I've just come back from some international travel and was unlucky enough to bring COVID with me, so I'm kind of struggling.
Okay.
Much better
It's COVID.
much better than I was the past 3 days. I'm going to survive it, and that's with diligence and mask wearing and hand washing. It just did not matter. So be careful out there, people. So what I would say, Dan, is let's get together offline, and I will promise to find a date.
That's great.
Thank you. I appreciate that. And Stefan, certainly appreciate you protecting those of us who should remain nameless in terms of our inquiries. And I would love to have an offline conversation. Some of the things I worry about is I know Older Americans Act, I've been told, is carved out of gravity. But I really don't understand what that means and how that flows down, because the reality is the services, the way they're currently defined in each state, really reflects the attribute of the service. And you can standardize another database all you want, but then you're not going to have truth and alignment with the service that is actually on the ground. Those legacy systems that have been there for 45 years are very entrenched in communities. So how do we navigate all that? There's a lot of things to discuss. I think it would be great if maybe we could spend a few minutes together at some point.
Yeah, I'd be happy to. I do have to stop now as well. I apologize. I know sometimes this group can go a little longer, but I've got to take my kids to karate practice. So, or karate, whatever you call it, lessons.
Taekwondo or Ishin Ryu?
What's that?
Is it Taekwondo or Ishin Ryu?
No, it's just traditional karate. Like, I don't know. Yeah, I could find out, but I don't know. Like, we signed them up, and it's my 12-year-old or my 11-year-old, sorry, and my 6-year-old. My 8-year-old decided he doesn't want to do it anymore, and he's going to focus on soccer. So whatever works.
All right, everybody, be well. Stay in touch. We'll see you next week, and we'll actually make sure we got the recording out. There's some great stuff on the recording and the notes. There's a lot of good chat in here. So for the folks who have committed to writing that letter, Stefan, I think we already have 5 people who signed up for the sub work group. So there's a bunch of people interested in it.
Great.
So
and sorry, I didn't put in the chat the White House findings. I'll do a reply to the group on the calendar I'll just do a reply to all with that link so that way you, or I'll attach it in there. So that way you guys have that. There's
What
other
was- let me
connected
just put
community.
that in the- let me just put that in the chat. White House findings. What is it? What-
It's the Community Connected Health Initiative, the RFI that went out earlier this year. And then they just released last week the summary report of like the key findings. And so I said I was going to put that in the chat, but I never did. So I will do a reply to all on the email list, and so just check your email for that.
Thanks. Okay. Thanks, everybody.
All right.
Be well.
Thanks all.
Thank you. Bye.